The question is from a young person who describes some symptoms that does sound like it's from reflux, but given the association of the symptoms, which were chest pain radiating to the left shoulder with palpitations, I think we cannot assume that this is from reflux disease. The reason is because these symptoms can also be from a cardiac problem, which can be very serious and be sudden in its onset, and there's no good way to tell just from the symptoms alone. So I think it is reasonable to treat with acid suppression medication, but if the symptoms do not improve, I think the safest thing to do is actually to get a cardiology review to make sure that these symptoms are actually not from the heart. Because it is a young patient, we tend to think that heart conditions are not so common, but given the symptoms which can be atypical for reflux, and certainly if they are related to meals, it may suggest that it's from reflux, or if it's related to activity or exertion, then it may be more likely due to a cardiac cause, but there is no simple way to tell just from the story alone. So I think the best thing to do is to exclude something that can be serious and that can deteriorate very rapidly, and obviously a heart condition should be excluded first. If you've excluded that, I think it's reasonable to consider treating this as reflux disease. But given that the symptoms may be a little bit atypical, it may also be better to see a gastroenterologist to at least get a gastroscopy, and in some cases even further tests to associate the symptoms with the level of acid reflux that may be documented.